Acute care, COVID-19, Stage 3 respiratory failure. The following slides are meant to be used as a resource for OTs preparing to address the needs of COVID-19 positive patients experiencing Stage 3 of the disease progression. This presentation focuses on resources supplied by the AOTA and others. All materials reviewed are available below. Please feel free to print, share, and add to these resources by commenting below the video or by contacting GOTA via info@gota.com. Patients in Stage 3 respiratory failure from COVID-19 experience acute respiratory failure and possible multi-organ failure, vasogenic shock, delirium, and ICU-acquired weakness. They likely require mechanical ventilation, prone positioning, ECMO, sedation, paralytics, and ventilator weaning. We're going to dive deeper into these details regarding how to address this population. Avoid the potential for contaminating non-COVID patients. Whenever possible, have equipment designated for COVID-19 positive patients. When this cannot occur, treat non-COVID-19 patients at the beginning of the day and end the day treating patients who are positive. As always, utilize proper PPE and hand washing techniques. When designating COVID-19 equipment, ensure the equipment is stored in close proximity to the unit or the area of the hospital where the patients are. When possible, leave equipment in the room to be utilized as patient-specific and train additional team members to utilize this equipment safely. The equipment to consider includes stretch chairs, high-back sitting chairs, rollators, tilt tables, ergometers, steps or blocks, bariatric equipment, tub benches, and 3-in-1 commodes. As noted in the AOTA decision guide, Therapeutic considerations for COVID management, prepare for the ICU patients by consulting their toolkit for OTs in the ICU. We have included their vitals chart here, which reviews ventilation, imaging, tubes, lines, and drains. The AOTA toolkit for OTs in the ICU continues with the review of activity orders, lab values, and sedatives or vasopressors. Remember that this toolkit was created for ICU level of care but not specifically for COVID-19 patients. Always consult with your medical team regarding lab values established by your hospital for the treatment of patients with COVID-19. Treatment techniques for patients with COVID-19 should focus on positioning. Consider creating a proning team or a proning schedule. Initial research has suggested that 12 to 16 hours of proning is indicated for vent-dependent COVID-19 patients. When in prone positioning, whenever possible, consider focusing on scapular strengthening and extensor strengthening. Focus on preventing soft tissue shortening of the intercostals, which will create resistance to diaphragmatic movement later. Progress from supported sitting to the edge of bed sitting. Address basic activities of daily living, reviewing energy conservation techniques. Once vent weaning, consider focusing on assisted cough techniques and airway clearance maneuvers. Some treatment techniques should be avoided to protect healthcare workers and environmental contamination. With vent-dependent patients, avoid anything requiring a disruption or disconnection of the vent or opening of the airway. Do not transfer from wall to portable vent. Treat COVID-positive patients in their room and do not transfer vent types. When vent weaning, only complete inline sectioning and avoid bubble-positive expiratory pressure due to the risk of both of these interventions causing droplet production. As noted in the AOTA decision guide, therapeutic considerations for client COVID management, consider the basics of how OTs complement specialty services within the ICU. Consider the positioning and the need for splints. Determine the need for safe meal management and consult with an SLP when needed. Consult with the patient's treatment team to ensure basic daily needs are met safely, including range of motion, transfers, mobility, and skin checks. Finally, ensure that your patient has a consistent way to communicate with fellow caregivers and with their loved ones. The Patient-Provider Communication Forum is a national and international effort to promote information sharing, cooperation, and collaboration among individuals who are committed to seeking improvements in patient-provider communication across the entire healthcare continuum. The Patient-Provider Communication recently published free PDFs of basic communication aids. Follow the link below for their resources. Supporting communication with patients who have COVID-19. This is a small sample of the free communication boards that they have shared with the public. See below for the link to their site. Remember, teamwork makes the dream work. When your patient is preparing to transfer out of your care into a new team, make sure that they're set up for success. Facilitate communication between patient and the family. Ensure communication aids transfer with the patient to the medical floor, rehab, or home with them. Help the patient package the materials that they have, including your splints, communication board, assistive technology, etc. Slides and resources are available below. Please print, share, and promote OT. Please share treatment ideas and additional resources in the comment section below. This material is produced by the Georgia Occupational Therapy Association. Contact us via our website or info@gaot.com. Thank you.